Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today we're going to talk about the anti-obesity medications and diabetes medications known as the GLP-1 agonists. These medications include Ozempic, Wegovy, Zepbound, and Mounjaro. Now, the first question that I want to go over is why are Ozempic and Wegovy getting so much press? Well, they work the best in terms of the GLP medications. Zepbound and Mounjaro have actually shown to be more effective in terms of reducing hemoglobin A1C or blood sugars, and also have the most weight loss associated with them as well. But I feel like people haven't quite moved on from Ozempic and Wegovy yet. I think they will as insurance starts to cover those more and they become more available. Let's look at this chart that I made. There's a lot of data, but bear with me. So I just want to clarify that the GLP-1 agonist medications have been around really since 2005 with exenatide, also known as Byetta. As we go down this chart, it sort of goes in order from when they were developed. It's not perfect, but exenatide was the first one on the market. And let's look over at the far right column, and you can see that with Byetta, people had about a 6-pound weight loss, and their hemoglobin A1C, which is a 3-month average for their blood sugar, reduced by 0.9%. Now, as you move down the columns, you can see dulaglutide and liraglutide were then developed. These were known as Trulicity and Victoza for diabetes specifically. And you can see the frequency of the dosing also changes. So you were seeing the same efficacy with a weekly medication, which is great. Then semaglutide burst onto the scene. And for diabetes, it's known as Ozempic, and it's a weekly medication, and you can see its effectiveness for dropping hemoglobin A1C is about 1.5 to 2%. Well, they also noticed that patients lost weight with this medication, and so they rebranded it as Wegovy, specifically for an anti-obesity medication, and patients lost 35 pounds. Well, then tirzepatide was developed, and that's a GLP-GIP combination with 2 hormones. It's known as Mounjaro for type 2 diabetes, and once again, it's a weekly injection and reduces hemoglobin A1C by 2 to 2.5%. So you can see even more effectiveness with that. And then they rebranded it as Zepbound for an anti-obesity medication, and patients lost a whopping, on average, 50 pounds, which is just incredible. So if you are on one of these newer GLP agonist medications and you're not able to get it because of supply issues, what next? You can talk to your doctor about exenatide, dulaglutide, and liraglutide, also known as Byetta, Bydureon, and Victoza. Now, in the short term, these medications may be fine, but realize that some of them you may need to go back to daily injections instead of once a week. And at the end of the day, they're not going to be as strong as semaglutide for the GLP-1, and especially they're not going to be as strong as tirzepatide, which is that GLP-1 GIP medication. But if you have been using Ozempic for your diabetes and you're no longer able to get it, then Victoza is the next best alternative for you, but realize you have to do the injection daily. If you're on Wegovy for an anti-obesity medication and you're unable to get it because of supply chain issues, then Saxenda may be a good fit for you in the interim, but realize once again, this medication needs to be taken once a day. Thanks for joining me.